Hello, my name is Dr. Sonja Rasmussen. I'm a pediatrician and epidemiologist, and I'm working with the Texas Council for Developmental Disabilities. I'm also a clinical geneticist, so I've seen many patients with developmental disabilities, adults and kids, for many years. In addition, I'm a sibling. I have an adult brother with Down syndrome. I'm here today to answer some of your common questions about COVID-19 vaccine, and I'll be focusing on the COVID-19 vaccine in kids. So the first question is, are children with intellectual disabilities at an increased risk for severe disease from COVID-19? What we found is that most kids are mildly affected with COVID-19, but some kids are severely affected and some kids even die. What we're finding is that kids with intellectual disabilities appear to be at increased risk of having severe disease from COVID-19. We don't completely understand why that is. Is it because they have a higher chance of being exposed? Is it because they have underlying conditions? But we do know that that means that kids with intellectual disabilities, with developmental disabilities, it's even more important that they get the protection that they can get from the COVID-19 vaccines. The next question is the vaccine safe for kids? The vaccine is really safe for kids. The companies that put out these vaccines did studies specifically in kids. They first did them in kids 12 to 15, and then they went down to younger kids, 5 to 11. What they've done is they've done clinical trials where they included some kids that received the vaccine, some kids that received the placebo, a shot that wasn't a vaccine. And what they showed is that the vaccine is effective. It works, it protects people from getting COVID-19 and protects from severe disease, and that it's safe. So the good news is that the studies that have been done, careful studies, have shown that the vaccine is safe. The next question, if my child gets vaccinated, can she take off her mask? This is an important question, and I know that we're all tired of COVID-19. We're all tired of wearing masks, but just because you're vaccinated doesn't mean you can take off your mask. It means that you're more protected against COVID-19, against getting COVID-19 illness. But right now, there's still a lot of cases out there, and so just being vaccinated is not enough protection. We need layers of protection, including wearing a mask. My hope is that in the near future, our numbers are going to get down to a level that are safe enough for all of us to be able to take off our masks. And we're all looking forward to that day. The next question is, can you get COVID-19 from the COVID-19 vaccine? And this is something we hear oftentimes with the flu vaccine too. The COVID-19 vaccine doesn't include a piece of virus, doesn't even include a piece of a virus. What it includes is some instructions, a recipe for your body to make a little tiny piece of the virus, not the whole virus, so you can't get sick with COVID-19 from it. It just gives you enough of that virus, enough of that piece of the virus that, or the instructions for the piece of that virus, that your body can learn to respond to it. Your body can see that spike protein and say, if I ever see that again, I'm ready to tackle it. I'm ready to beat it down, and so that you don't get severely ill or your child doesn't get severely ill. So it's not possible to get COVID-19 from the vaccine. The vaccine doesn't contain the virus. It contains a recipe or instructions for a little tiny piece of the virus. When will the vaccine be available for kids under 5 years of age? And this is a hard question to answer because we're waiting for those studies. And I want the companies to do like they did with the vaccine for 5 and above. I want them to do all the studies they need to do to make sure that the vaccine for under 5-year-olds is safe. I think most people expect that it's going to be late spring, maybe early summer before we're going to see a COVID-19 vaccine for kids under 5. But a lot of things have happened a little more quickly than we thought. So maybe it'll be sooner. It's hard to know for sure. But I want to make sure that the companies do the studies they need to do, like they have for kids 5 and above, to make sure that it's a safe and effective vaccine for our younger kids. So I know many of you have questions, and there's nothing harder than making a decision about whether or not your child gets a vaccine or a treatment. I know that there's a lot of misinformation out there. A lot of people are spreading information that's not true about this vaccine. So I encourage you to continue to try to ask questions. If you still have questions, you can reach out to the Texas Council for Developmental Disabilities. You can talk to your pediatrician or clinical geneticist or other doctor. We want to answer your questions about the COVID-19 vaccine. I do want to encourage you, and I've heard a lot of families say they want to wait and see. They want to wait until their child gets the vaccine. I would encourage you not to do that. I think get the information you can and make that decision to get the vaccine now. We're entering a very concerning time. We know that last year around the holidays, we had big spikes in the number of cases. We also know that right now there's a new variant, an Omicron variant, that seems to be transmitting very, very quickly, very easily throughout the population. So this is now an important time to get vaccinated. If you haven't gotten vaccinated yourself, it's important for you to get vaccinated as well as getting your child vaccinated. And if you've got vaccinated, but you haven't gotten the booster, now's the time for that. I encourage you to do that, and thank you for listening.